of Dermatology. She's worked with world-renowned African-American dermatologist Seymour Weaver. She's also currently working for Milton Moore and More Unique Dermatology and Spa. She's a member of the Dermatology Nurses Association, and she is the recent recipient of the Volunteer Honoree Award presented to her by City Councilwoman Wanda Adams and the City Council members of District 8. So y'all please help me welcome Bill LaRue.
We have an epidemic right now that's going on with black hair. And that epidemic is that women are over-abusing and treating their hair, just too many chemicals, using weaves, sewing, gluing, to get this look. But then at the end of the tunnel, you have permanent hair loss. And that's what we see. So in a derm perspective, we see all of that. Young ladies between the ages of, say, 25 to 40, when they come into the office, they're at a point that there's a lot of hair loss right here in the vertex. And that's from tension, that's from the sewing, and that's from the gluing. So we have, I want to name all the different types of hair loss that we see. You see the alopecia areata, bald, slick patch that comes and is stress-induced. You have telogen effluvium that comes from, say, surgery, anesthesia, giving birth, childbirth. You have a baby today. Next month, you notice your hair starts shedding. That's called telogen effluvium. You have neurodermatitis, which means hair loss from scratching. Don't a lot of women, sometimes you find yourself scratching a certain spot, or when you scratch the scalp consistently in that one location, the hair sheds all the way down, and there's a certain pattern that we see. Your hair could be long all the way around, and then it just chops at one level, straight across. So we know that that's neurodermatitis. Then we see a lot of chemical damage hair, and that's from the chemicals. Over-processing the hair becomes weak, the follicles die, and the hair just falls. So that's another type of hair loss. The traction from the braids, too much braiding. I always use Stevie Wonder, and I always say, when you look at his receding line, it starts here, but from braiding the hair too tight, the hair starts shedding and goes back, all the way back the way he is now. I said one day he'll just have one little ponytail. Too much tension at the borders of the hair margin. So I'm kind of giving you all of this because I'm putting it all together to say that natural hair is really the way to go if you want to preserve your hair so you 80, 85, is that on our end, then we have to give you medicine. And the medication that we use to treat these problems are corticosteroid solutions, betamethasone, Cobex, we use fluocinolone, all these corticosteroids to reduce inflammation, because that's what happens. The scalp becomes inflamed when you're losing the hair, and when it becomes inflamed, your pores shut down and they get tight. So layers of dead tissue start accumulating. And when the dead tissue accumulates, the hair doesn't pass through. So what we do is we put you on corticosteroids. The corticosteroids brings down that inflammation. It takes off all that dead layer of tissue that we don't visibly see, but it soothes off the skin. The pores open, and it's a process, and then the hair starts growing. So that's one approach that we use. Second approach we use is actually injections, Kenalog injections. And we use 2 milligrams or 5 milligrams of Kenalog to inject just a little bevel deep into the scalp to open up those pores, bring that inflammation down again. Okay? We also use vitamins. I did a study, this was several years ago, I did a study on glycerin, and I also did a study recently on biotin and grapeseed extract. And my study worked. It really did. I did a lot of research. It said if you take grapeseed extract, which is the most powerful antioxidant, and you use it to treat hair loss, it stimulates the circulatory system. So when it stimulates it, the blood flow goes up in here and stimulates it, and then the hair activates and it feeds on it, so it stops the hair from going into the stage of hair loss. Okay, patients that actually have bald spots. I wish I could have brought you some pictures to see a patient with actually, really chronic hair loss from the weaving, the gluing, the sewing, the bonding. These patients have brought a breakthrough in our facility because the grapeseed and the biotin mixed together 5,000 micrograms of biotin, taking 100 milligrams of grapeseed extract, combining the two together on a daily basis. After 3 months, we noticed that the people that we said to that they had developed scar tissue from hair loss, we noticed hair passing through. So it worked. So now we're implementing that. So that's the treatment. We also have medical conditions called seborrheic dermatitis, which is very common with black women. We think that we have psoriasis or just regular dandruff, which it really is dandruff, but that produced it. You see the flakes on the scalp? Sometimes you see it on the face, you see it on the eyebrows, you see it on the ears. That's called seborrheic dermatitis. And all that is the body is producing too much oil. When it produces too much oil, it sits on the scalp and it looks like flakes, like dandruff. So here again, that can cause itching. There could be a possibility of yeast infection triggering or occurring on the scalp. And here again, we treat it with corticosteroids. We treat it with one week course of Nizoral tablets, which is an antifungal pill that fights the yeast. And then the person's relieved from that itching, which that itching can also trigger hair loss. So I say all this in derm because I have kind of made a breakthrough with Seymour Weaver and Dr. Milton Moore to educate the women and stress to them that natural is the way to go.